It's my Saturday soundtrack. It's me, Michael. You're listening to Sheffield Hospital Radio, and I've got a guest again this week, which is always fantastic. And this week it's Beth. Welcome, Beth.
Hi, Michael. Thank you so much for having me.
Thank you for coming. So, Beth, you're the Chief Executive at Sheffield Hospital Charities. So tell us a bit about the charity. What do you do and how do you help Sheffield Teaching Hospitals?
Sure. Okay. Well, first of all, I'd like to say I'm a little bit disappointed that you're not wearing your gold sequin blazer because
it's the power of radio. You could have pretended I was.
Yeah, good, yeah. So yeah, we haven't had much chat before, have we? But every year at the NHS Thank You Awards for the teaching hospitals, Michael, the years that I've been there, you've always been wearing quite a dashing outfit.
Thank you.
So yeah, anyway, thank you so much for having me. Yeah, Sheffield Hospitals Charity exists to support our NHS here in Sheffield. So we support the teaching hospitals and also Sheffield Health Partnership University Trust, which is, in layman's terms, the mental health trust. In a nutshell, what we do is we raise money and we give it to the NHS. Everything that we do, everything that we fund is above and beyond NHS statutory provision. So the care that the NHS has to provide, we don't do that. We do the above and beyond. So a huge amount focused on how do we make the patient experience better? How do we support our staff in terms of their well-being, in terms of their professional development? How do we support the NHS by driving investment into research and technology and innovation? And how do we work across the city, really, with lots of different partners to think about how do we tackle health inequalities? Because we know that a lot of stuff happens outside of the hospital that affects people's health, and then they present in hospital, but you're sort of trying to unpick and address things that are a result of things that are happening much further down the chain in their lives. So we're doing a lot of work around health inequalities as well. But yeah, in a nutshell, we raise money and we give it to the NHS.
And give us a feel, Beth, what kind of sums of money are you able to raise for Sheffield Teaching Hospitals?
Yeah, we're raising around 3 million
Wow.
a year. I would really like to see us raising a lot more than that. If we think about the size of our adult NHS, so the two trusts that I mentioned, there's around 22,000 NHS staff across those two trusts, the majority with the teaching hospitals, of course, and 2 million people cared for by the teaching hospitals alone. So our remit is the biggest healthcare remit across the city. So we're doing a lot of work to raise our profile, to be able to increase the amount that we raise so that we can give more to the NHS.
And give us a flavour, we're going to get into more detail, but so that kind of £3 million plus, so that's helping staff, buying equipment, what just give us that kind of top list to whet our appetite of the kind of detail that we're going to learn a bit later on about the things that you help with across Sheffield Teaching Hospitals.
Yeah. So we're raising about 3 million. We're giving out more than that because we've had our what we call charity reserves, essentially like your piggy bank, if you like.
Right, your savings account.
Your savings account for when it rains. I don't know, we can stretch the analogy there a bit, can't we, in terms of like for the NHS, it's absolutely tipping it down at the moment. So we're spending more than we're bringing in at the moment, which obviously isn't sustainable, but we're doing that in a really financially prudent way. So over the past few years, we've spent a little bit more. Last year, we gave out 3.3 million. And this year we're giving out 4.2.
Wow.
Yeah, so we really need to up our fundraising and support from the people of Sheffield, who are incredibly brilliant and generous and ingenious in their fundraising ideas. The areas that we support, in very simple terms, stuff for patients to make sure people have the best possible experience while in hospital, stuff for NHS staff to make sure that they feel supported within their roles and within their careers. Research, technology and innovation. That sounds really abstract, doesn't it?
Well, we'll find out more in a bit. Yeah.
Cool stuff to make things better.
Yeah.
And then tackling health inequalities. So addressing some of that stuff that happens outside of the hospital, which reduces pressure on the NHS.
Fantastic. Well, we're going to dive into each of those, and you've come with a big bag of CDs and a very long song list, which is absolutely fantastic because our listeners know that I've got quite an eclectic mix of songs, but it's going to be even more so today. So do you want to tell us a bit about the first song that you've picked and why, Beth?
Yes, absolutely. So I've approached this over-prepared. 100% over-prepared for this. I've approached this show today as the charity's Desert Island Discs, if you like. So the first song is One Nation Under a Groove by Funkadelic. Hadn't realised it was 7 minutes long when I chose it, if I'm honest, so we're not going to play all of it, are we? And the reason for this is that research shows that of all the things, the NHS is what people are most proud of in terms of what makes you proud to be British. Well, the number one thing is the NHS. People love it. Yeah, they recognise there are challenges, but they don't want to necessarily change it. They just want it to work a bit better. So, I think we all agree that free universal healthcare is absolutely wonderful. We love our NHS. So, yeah, One Nation under a groove of our fabulous NHS.
You're listening to my Saturday soundtrack here on Sheffield Hospital Radio, and I've got Beth with me, who's the Chief Exec at Sheffield Hospital Charity. And you were telling us the kind of 4 areas that the charity supports with in terms of supporting our patients, supporting our staff, research and innovation, the kind of cool, exciting bits, and health inequalities. So let's find out about each of those areas. So tell us a bit about what you do for supporting our staff, Beth.
Yeah, so I mentioned just earlier that I think there are about 20,000 staff, aren't there, across Sheffield Teaching Hospitals. So a huge group of people, really diverse group of people. We often talk about the NHS in terms of nurses and doctors and consultants, but as a charity we recognise that the staff base is much beyond that as well. And people in facilities and estates and porters and the arts team and the team that manages our volunteers are all absolutely crucial to making sure that the hospitals work effectively and efficiently. So we know that the NHS staff are the lifeblood of the NHS, aren't they, across the country? So we want to do what we can to support them here in Sheffield. We know some of the challenges that are faced with the NHS at the moment in terms of getting people into jobs with the NHS. So sort of, I guess, a workforce challenge in terms of numbers of people entering the NHS. And we know that burnout is a real issue as well. I think we saw a huge outpouring of love for the NHS during COVID, and that sentiment has perhaps shifted a little bit, but at the charity we're still right behind you. We might not be banging pans. Odd response, isn't it? Collectively that we had as a nation. Sure, let's get some pans. They'll love that.
Exactly.
Yeah. Anyway, I digress. So we do a huge amount to support NHS staff, working alongside various teams within the teaching hospitals. We support Rhiannon Bishop's team around well-being and
so that's a health and well-being team, is that?
Yeah, exactly. So training people to be well-being champions so that people, NHS staff across the trust, regardless of department, are able to understand what's on offer to them and access support that they need. So that's a big part of work. We fund training for NHS staff that's above and beyond what they have from the teaching hospitals to be able to do their job. But we're thinking about, well, what's next? How do we enhance patient experience by staff being more and more skilled up? So we fund lots of people across the trust to be able to go to very specialist conferences and training courses. We also do something that I absolutely love, which is a travel scholarship. So we have a few people each year who are supported to go to a different place, whether that's somewhere in the UK or I think we've had a couple of people to Canada, maybe Australia, go and learn about something there and bring back the learning, or at least understand why we wouldn't do it here because the context perhaps is a little bit different.
And you're
or take
covering the
bits.
costs there then? Is that kind of grants and bursaries? So
Yeah,
stuff? Wow.
exactly. Yeah. So I think overall we have probably around £70,000 or £80,000 a year go into staff training and things like the scholarship. We fund the national, it's not national, annual thank you awards for staff, which is on the 23rd of April when you get your suit out
Gold jacket,
once a year. Which is a great evening, isn't it, where we recognise staff from across the trust. So
and that's so uplifting, and that's that opportunity around. I presume you support that with venue and food and things, so it's not taken from NHS funds, but we can have that event that celebrates staff, shares good practice, recognises rewards.
So from our supporters donating to us, we fund the entirety of the cost of that. So it's a really beautiful evening. It's people are nominated by their peers, aren't they? And then the Teaching Hospitals comms team put together these really beautiful videos about people, what people are saying about each other, and it's really gorgeous and quite emotional at points, isn't it? So yeah, loads of people are recognised across the evening. So yeah, really looking forward to that. And then in terms of I guess a couple of really specific examples. So we had a phase where we funded a lot of gardens.
Right.
We seem to do a lot of gardens.
Daylight today, though. Probably a good place to
exactly. So for example, we funded a rooftop garden at Weston Park Cancer Hospital for staff. We've done one at Jessop's Operating Theatre recently. We have a secret garden, which is probably because it's quite difficult to find, but when you're there, it's absolutely massive. So there's a bit of interesting.
And is that at the northern, that secret
That's
garden,
at the northern, off Vickers Corridor, if you can navigate that, because it's a metropolis, isn't it, the northern? Yeah, I get lost every time I go there, actually. And then really specific things, just to give you a sense of the breadth of stuff. So a hyper-realistic mannequin, right, for major trauma team training. So this is where, if you are, if a patient has been involved in a significant accident or incident and they come in with multiple life-threatening injuries, they will be potentially come in a helicopter to the Northern General and be met by a multidisciplinary team of consultants. Now, we want that team of consultants to be as well trained as possible, because every second counts, hence arriving by air. So the hyper-realistic mannequin, for normal civilians like you and I, it comes with a trigger warning, because it's really, really intense. You can catheterise it, you can do open the chest on it. Gosh. Yeah, so that cost in the region of £70,000.
Wow.
It's not a cheap bit of kit, but it's reassuring to know that for people who need that kind of intervention from a multidisciplinary team, that they are being trained on the best possible kit. So things like that.
It's amazing.
It's so diverse.
Wow.
So our NHS staff are brilliant. We're doing what we can to support them, chosen.
Great. So tell us about this next song.
Yeah.
Yes, I want to come back after the song and help our staff know how they navigate to access some of that support and help if that's possible. But before we do, this is a great song. Tell us about this one and why you've picked this one.
I just think it's a really great track, to be honest. NHS staff could have been anything they chose to be, but they chose to support us. So
and I love it. My listeners know I love a musical. This is from Bugsy Malone. I feel like we need the spud guns and potato guns out. Am I remembering the right scene?
I think so.
Yeah. You give a little love. Paul Williams from Bugsy Malone. So you were telling us just before that song about all the stuff that you do for staff across Sheffield Teaching Hospitals. How, if a member of staff's listening now and they had a course they wanted to bring in, they needed that health and well-being support for the team, they were thinking about looking at a travel bursary, how would they access those kind of things, Beth?
The easiest thing to do is to go to our website, which is sheffieldhospitalscharity.org.uk. And on there, we have a special section which is dedicated to NHS staff. So that gives all the details about how to apply for a grant and how to access our funding calls as well. So a couple of ways in which we give, it's all through grant making, but in terms of how to work with us. So we hold around about 180 funds. So imagine 180 pots of money which are restricted for a certain use. So this is where a donor has said, usually in gratitude for the care that they've received. Me or my partner or loved one was cared for incredibly well on Chesterman, for example. So I'd like to leave some money. I'd like to give some money towards that area, so cardiology broadly. And so that's how it becomes restricted. So we hold lots of restricted pots of money, and people can access them if they're in that team. Additionally, we have what we call unrestricted funds, so where we have general funds that the charity can use to put where the need is greatest. And obviously there are lots of lenses through which we look to be able to decide what the best use of that charitable money is. People can talk to us about ideas that they have at any point. So have a look on the website and contact us. Shasta and Danny are our grants team. We're a small charity, so there's about 23 of us at the moment. We are hoping to grow, recruiting at the moment. But yeah, get in touch, have a chat with us, drop us an email.
And I presume you'll navigate through there. If people are thinking, oh gosh, what's all this about these pots or how to do it, you'll absolutely help them hold their hand, make it as straightforward as possible.
Yeah, absolutely. So what we do is we say, okay, which team are you from? This team has some money over here or it doesn't, and then we can help you literally help you navigate.
And give us that website again, sorry, what was it?
SheffieldHospitalsCharity.org.uk, and I think if you put /NHS, then it'll go directly to the NHS staff site. And we have 3 funding calls a year as well, which is part of us trying to say, right, we've dedicated some money towards certain themes, and it's a way of us making sure that we are proactively pushing money into the NHS rather than waiting for applications. Right. So this year we'll have a research round which will likely be focused on cancer. I'm not sure of the timing of this just yet, and that is to be confirmed, but obviously STH has a priority around cancer diagnosis and treatment, so that's the rationale for that. We'll have a funding call around health inequalities and also around supporting NHS staff as well.
And that's in 2026, all those things will come through, is it?
Yeah, it's over the next financial year.
Fantastic.
Yeah, so essentially have a look at the website or give us a call or drop us an email and we'll help you navigate it. One thing, we also have a pot called Little Wishes, which is for teams that don't have a restricted fund of their own, and they can get in touch with us and apply for up to £5,000 for stuff that they just want to crack on and be able to get on with.
Okay, that sounds fantastic. Now, talking of our individual teams, we've had a request in, and you mentioned A&E earlier, and this is from the matron in A&E who was on a few weeks back. So do you want to read out the request for us, Beth?
Yeah, absolutely. So, oh my goodness, what a job they have on in A&E. I'm always amazed by how a lot of NHS staff actually do their jobs.
Amazing, yeah.
Absolutely amazing. So this is from Sarah Briggs, the matron, A&E matron who was on a few weeks ago, and it is Kate Bush.
Find out all.
Woman's work.
Looking for fixings and fastenings you can rely on? Since 1991, ForgeFix.co.uk has been the trusted name in trade supply.
If you've only just joined me, it's me, Michael. This is my Saturday soundtrack here on Sheffield Hospital Radio. And this week I'm joined by Beth, the Chief Executive at Sheffield Hospital Charities. So, Beth, we're coming on to talk about technology, and clearly that beat me there. So we've just had Kate Bush, which was the request you were reading out for Sarah Briggs, the A&E matron, and then I played some adverts over here, so apologies for that. But yeah, I did it all on purpose to kind of make the point about technology. So tell us a bit about why David Bowie and changes that you'd picked there.
Yeah, sure. So David Bowie, because he's a legend. It's 10 years since he died as well.
Gosh.
Which is, it just feels like a few years, doesn't it? My little boy's 10 in a couple of weeks, and that's how I've sort of remembered it, and that feels unreal as well. So, yeah, change. So research, innovation, technology in the NHS, it's all about driving more positive change, looking ahead to the future. So Sheffield Hospitals Charity has given its largest ever single gift to the teaching hospitals of 1.45 million to support the purchase of a surgical robot.
And if I just stop you there, because we're going to play a bit of robotic music while we're chatting around that in the background, a bit of Daft Punk.
Seamless. I love how seamless that is, Michael. Yeah.
So, £1.2 million surgical
1.45.
robot. Oh, wow. It's gone up,
yeah.
inflation.
Yeah,
£1.45 million robot.
Yeah, 1.45 million is the Sheffield Hospitals charity contribution towards the surgical robot. And this will be hosted at the Northern General Hospital. There's already one through a significant philanthropic gift through the charity a few years ago, which it's a Da Vinci robot at the Royal Hallamshire. This one will be the first at the Northern General and used predominantly for cancer surgery. So in a nutshell, it's less invasive surgery, so you are quicker to recovery and quicker to recover and quicker to get home. It also addresses a current inequity in terms of surgical treatment for cancer across the region more broadly. So hugely important. Of course, it aligns with the NHS Cancer Plan as well that was recently announced, and we're just hugely grateful to our supporters who have enabled this to happen.
And so, obviously, as you say, the Trust has already got a number of robots. So going back to what you were saying earlier about the charity is there to support kind of additionality, how's that work with the robot, and kind of how's that not core surgical equipment? Is that just because it's buying more and it's fantastic technology?
Yeah, it's a little bit of both. So without our contribution, the teaching hospitals wouldn't be able to do it, and it would continue doing the surgery in the same way as it does at the moment. And so through our contribution, we're able to make sure that more people have access to robotic surgery, which, as I said, makes a huge difference to patient experience and people having a less invasive procedure, etc.
I think that's cancer and non-cancer pathway is the plan.
Yeah, I think it's predominantly cancer pathway. So all cancer surgery predominantly takes place across the Hallamshire and the Northern General, with a little bit across Jessops and Charles Clifford. More than 3,500 cancer surgeries across the Trust. This is a huge boost for cancer patients right across the region.
And can I ask, while we're talking about innovation, I hear a lot of talk about the Dragon's Den work, which I think is one of the things that the charity really kind of puts pockets of money out and about into the organisation. Can you tell us a bit about Dragon's Den?
Absolutely.
Sounds scary.
It does a bit, doesn't it? I think I probably would be quite intimidated if I was coming in to present to that group, because it's quite a group of people in the room. Dragon's Den is an innovation challenge that we run in partnership with the teaching hospitals. It's usually a match fund, so we both put in the same amount. I think the charity's picked up the funding for it exclusively this year due to cost pressures, which we're really happy and proud to do. Dragon's Den is where anybody from across the teaching hospitals can apply with their innovative idea. It's an annual thing that we run. It's managed by Wendy Tyndale's team, the CREO team, which is fantastic. So it's a really robust process. It's £300,000 a year, if I didn't already mention that. And so myself and Shasta, our Director of Grants from the Trust, sit on the panel. So lots of applications, they get shortlisted, and then the successful ones who are shortlisted come forward to present to the panel. And it's such a great couple of weeks where we have these afternoons where we all sit and listen to these presentations, because particularly as non-medical staff, we get to hear about the breadth and depth of work across the Trust. So it'd be from community diagnostic stuff, wound management, through to one of my favourite ones from last year was a little bit of kit in A&E. So if you have a heart attack or suspected heart attack and you go into A&E, you have a blood test to check for, I'm simplifying this, right? So this is not a medical
medical advice.
do not try this at home, sort of thing. But the bit of kit basically tests for troponin, which is a protein in the blood that indicates that you've likely had a cardiac arrest. Without the piece of kit, the blood test takes around 2 hours to turn around at the Northern General. With this bit of kit, they can test if troponin's in the blood within 20 minutes, which means that patient gets seen faster, you can rule it in or rule it out and get the patient to where they need to be. So that's the kind of stuff where, it's really difficult sometimes to talk about the breadth and depth of the work that we do, because it's like, which bit do we talk about? Because there's so much of it, and it's all, it's quite literally life-changing. So yeah, Dragon's Den is another thing that we do and we absolutely love. Yeah.
Fantastic. Welcome back. It's me, Michael. It's Sheffield Hospital Radio, and it's my Saturday soundtrack. And if you missed the first hour, where were you? But for the second hour, I've still got Beth with me, who's the chief exec at Sheffield Hospitals charity. And she's helping us on behalf of the charity. We're curating their playlist today. And so coming out of the news, we had Destiny's Child there. Why that song, Beth?
Well, Destiny's Child were amazing.
Absolutely.
That's part of the reason.
25 years old, though, that song. Can you believe it?
No, I was just saying it's a great video to it as well. I think it still sounds fresh. Or maybe, oh, God, I've just used the word fresh. So, obviously,
down with the kids.
I am ageing rapidly.
Probably means something else nowadays.
Yes, yeah. Anyway, yeah, partly chose it because it's a banger, partly chose it because it's a nice segue into talking about health inequalities. We have a public...
And just give us a feel, sorry, before you do, for our listeners, when we talk about health inequalities, what do we mean by that?
What are we actually talking about? Sure. So a lot of the things that affect our health, and therefore what happens within the hospitals, are a result of how we live our lives outside of the hospital. So we call it social determinants of health. So things that affect your health that the NHS can't do a right lot about are things like poverty and deprivation, the area in which you live in, ethnicity,
employment, is it those kind of things?
Yeah. They're all really complex, very complex, multifaceted things that mean, certain groups of people are less likely to have positive health outcomes, and that is in many ways nothing to do with the care that they receive within the hospital, but the lives that they live outside. And that is not because they are not doing the right things, but it's more about society as a whole.
So almost outside of their control.
It's basically about societal inequity, right? So we know that in Sheffield, the disparity is, I'm trying to choose my words carefully. Disparity is really significant, okay? So from the start to the end of the 83 bus route, so that's essentially southwest, leafy, affluent.
So kind of forward Ecclesall way.
Yeah, Totley. Through to the northeast of the city, the difference in life expectancy is 10 years, and it's 20 years healthy life expectancy. So,
and by healthy life expectancy, what do you mean by that?
So the point at which you will be living with conditions that affect your health,
okay.
Which then obviously impact on your employment and
mobility.
Yeah, all of those things. Yeah. So what we want to do is help to tackle the things that we can that help people to live healthier lives and relieve pressure on the NHS and mean that the NHS can spend more time addressing the things that can be medicalised. We're doing a number of things in this space. One of them is what we call a high-intensity use service at the Northern General's A&E department. So we know that A&E is under significant pressure across the country. Like, this is not about Sheffield, but Sheffield obviously has its own challenges in that respect. So we have been working with the team there, who are just fabulous in so many ways, to pull together a programme which takes the people who come to A&E really regularly and go, right, what support can we give you to sort of break the cycle and address the things that are outside of the hospital that mean that you are presenting within the hospital. This is not NHS provision. This is where we do the above and beyond bit. So the charity is funding British Red Cross, phenomenal organisation, to provide this service to NHS patients. So this is if you're presenting because of domestic abuse, because of really poor housing, because of mental health challenges, because of alcohol or drug misuse, etc., then it's a conversation with those people to go, what's going on in life? How can we help you? So it might be supporting people to get along to the alcohol dependency team. It might be helping somebody to access support from Citizens Advice to be able to say, there's a terrible landlord here is making their life impossible. It might be, and you know, on that, it might be that they're attending frequently with a respiratory problem and they get given the medication, but we're sending them home to a damp home. So it's addressing those things outside of the hospital that then, by addressing those, we relieve pressure.
Great. And so that's a charity, you as a charity supporting British Red Cross to support our patients in the department. And has that started? How's it going?
Yeah, it's amazing.
Right.
So, yeah, us supporting, essentially funding other organisations because they are the specialists to be able to provide the service is something that we've started to do a little bit more of. And there are reasons for that. NHS staff are really pressed for time and capacity. The more that we can do to support them through third parties is on the whole, a good thing, but obviously there are some things where we want to go. We need to embed it within the NHS so that it stays within the NHS and it isn't always seen as an above and beyond additional bolt on, or the charity will sort it out. Also, from a personal professional perspective, I'm hugely passionate about the role of the voluntary and community sector in supporting healthcare. So yes, we are here to support the NHS, but without charities, many charities, the NHS would not function properly. So, you know, British Heart Foundation, Macmillan, St Luke's, Teenage Cancer Trust, so many organisations locally and nationally that support the NHS. And we, Sheffield Hospitals Charity, have a unique role to play in supporting our NHS and working with partners to be able to address things.
It sounds like you're ideally placed to kind of almost coordinate that and kind of really look at that holistic patient. What do they need? There's some element of acute and community care that Sheffield Teaching Hospitals could provide, but here's some other social, voluntary, third sector teams, people that can actually wrap around that patient completely.
It sounds like I've told you exactly what
I've heard
what I want
it's
you
brilliant.
to say. So yeah, exactly that. Yeah. So that's a big programme of funding. You asked how it was going. It started in October, and they're doing reports for us every 3 months. So we haven't got a huge amount of data because we've got from October to December, and obviously they started part way into October, so we haven't got a full quarter. But what it is already showing is we are targeting a 40% reduction across A&E attendances from this cohort that we're working with, ambulance conveyances and non-elective admissions, so people who weren't expected to be admitted into hospital, and we're hitting those targets just on the small cohort that we've had in the first quarter. So, yeah, and
amazing.
The stories... Oh, God, the stories are really beautiful coming out of it as well. It's just a reminder about why we do what we do.
Absolutely. Yeah. And with that in mind, should we tee up the next song, which I think was kind of to frame some of that health inequalities conversation, a Jean Knight song?
Yeah. So, like I say, we're doing lots in the health inequality space. That's an example. We have a campaign called, I'm not in front of the mic, to have a campaign called No Woman Left Behind, which is focusing specifically on women's health inequalities, which we can talk more about after this song. So this is, where am I? It's Mr. Big Stuff by Jean Knight.
Fantastic. Thanks, Beth. that was really interesting kind of hearing about some of that broader work on health inequalities and the impact that they have, kind of social determinants of health, and then that specific piece of work in A&E. But I've seen a lot about your No Woman Left Behind campaign. So that sounds fantastic. Tell us a bit more about what that campaign is and why the charity is supporting that in particular.
I guess when we think about health inequalities, you can spend a huge amount of money and just scratch the surface with it. So we wanted to be really clear that we focused on areas where there was significant need and where the charity was uniquely placed to be able to make a difference. That, like what you were talking about, when I felt like I'd put the words in your mouth, but I hadn't. It was amazing. The alignment, it's just beautiful. So about just over 12 months ago, we pulled the data for Sheffield and said, right, what's going on for women? Where are outcomes perhaps not as good as they should be, or where do we not benchmark particularly well as a city and a region? And this isn't about NHS performance necessarily, it's about general health and outcomes for women. So lots and lots of research about this. Really proud that we have Professor Bola Owolabi as our ambassador for health inequality. So for those who don't know her, Bola is now working for the Care Quality Commission, but previously was at NHS England and was their lead for tackling health inequalities across the UK. And Bola she's phenomenal. This is a whole aside, but she's the most amazing communicator. And when I have a conversation with her, I genuinely think, God, I wonder if this is what it's like having a conversation with Obama. And you're just completely in awe of somebody. So, she's brilliant, and she's been such a great advocate for us, and she's been so brilliant for me. Just me in terms of supporting my thinking around this space. So what we did was we pulled out 3 areas where we thought we're really well placed as an organisation to be able to do something in this space. So we looked at maternal health, we looked at early cancer diagnosis, and also gender-based violence. So taking those 3 things, we have been working on maternal health. So we know that black women 4 times more likely to die during perinatal period, which is essentially the point of conception through to 12 months, when baby's 12 months old. Black women 4 times more likely to die during that period. Asian women twice more likely to die during that period than white women. And deprivation then skews it again by another 50%. Wow. So when we look at the population of Sheffield and that bush route that I was talking about before, we can think, how and where do we put in place support to be able to address this? So we've been working with Kaya Rothman, who's a consultant midwife in Jessetwing, and also with public health colleagues, and also with Save the Children, to develop a programme of support called Connected Beginnings. And we are just at the start of trying to secure some funding for that, to get that going for the next couple of years. That's really exciting in many ways because it's going to be a phenomenal programme of support, but having Save the Children involved in that means that we will have a sort of research and policy person embedded within the programme, which will then develop policy recommendations that will influence the child poverty strategy regionally, which is endorsed by Mayor Coppard and things like that. So that's what, when we think about what can the charity bring, we'll go, right, how can we do this at scale and really well, and in a way that we aim to embed it fully. So that's a maternal health bit. And of course that influences child outcomes as well. Yeah. So we're looking at things around dental hygiene. So we know in Sheffield, I think it might be nationally sort of the highest extraction rate for under 5s, obesity, being school ready, immunisation rates in some parts of the city don't meet herd immunity thresholds, things like that. So by providing an early intervention piece for women and birthing partners at Jessetwing, we're aiming to support women, but also obviously it has an impact throughout life. Another programme of work is around early cancer diagnosis. So last year we piloted an event in Fir Vale. So we know that we worked with the Foundry PCN, which is a group of GP practices in the north east of the city. and we put on a day at Furvale Community Centre, and this was around focusing on women's health and highlighting that people should really sign up and get their cervical smears. Okay. So NHS England has an ambition by 2040 to eradicate cervical cancer. That very broadly, again, without any medical training, very broadly, that will be achieved through vaccination, which broadly sits within young children and young people, so not our remit. And then the other part is around earlier diagnosis, and cervical screening has a significant role to play in that. We know that through Foundry PCN colleagues, GPs in the northeast of the city, that people in that area are much less likely to take up their cervical screening. So it's the lowest in the region, if not nationally. So we put on a day which was a pleasant day in itself, something that women would want to go to and socialise at and would be receptive to hearing more. And we would, our NHS colleagues there would book them for their cervical screening. No, cervical screening. One of those, cervical screening on the day. And then when they returned for their actual screening, it would be the same group of staff there. So trying to
build that rapport and relationship.
Build trusted relationships. And the way to do that is 100% through community partners. The third piece of work, which I'm so proud of, is around gender-based violence. So we know that in Sheffield, domestic abuse is higher than many other areas in the country, in terms of number of incidents and also in terms of severity of incidents as well. There's loads and loads of reasons for that. And what we found out through the Cavell Nurses Trust, they did some research into nurses, midwives, allied health professionals and domestic abuse, and found that that group of people are 3 times more likely to be affected by domestic abuse than the average person. Again, so many complex reasons why that will be the case. And so, again, as a charity, we went, right, well, how are we uniquely placed to be able to support this? And so the Teaching Hospitals alone is the largest employer in the city. 20,000 staff just within this trust, 75% of them are female. Yep. It's happening. We know it's happening, but we're not currently tracking it, so we can't exactly pinpoint the scale and impact of it, but we know implicitly that it's happening. So we've worked with IDAS, which is the Independent Domestic Abuse Services charity. They're a regional provider of domestic abuse support, and have developed a programme that actually spans both trusts, so the Teaching Hospitals and Sheffield Health Partnership University Trust / Mental Health Trust, to support people affected by domestic abuse. Yeah. And we've secured £250,000 from NHS charities together. Wow. They're just about to start on the ground, as it were. And there are 3 things that programme will be doing. So one is direct support to people affected by domestic abuse. While this is stemmed from our women's health inequality work, it is an inclusive programme, so it is anybody who is affected. That direct support also involves a fund, a safe haven fund, where people could access up to £2,500, because we know that breaking the cycle of domestic abuse, there are financial implications. So we want people to be able to put a deposit down for some rent if they need to, as opposed to 50 quid here and there. The second piece is around working alongside NHS programmes and procedures that already take place, so working with HR teams, working with the health and wellbeing team, working with trade union reps and people who are more likely to come into contact with people who have been affected by domestic abuse, to encourage early disclosure so we can get people the support that they need. And the third piece is around tracking it. So I mentioned it's not tracked within STH's staff survey, but it's not tracked within anybody's staff survey. Yeah. So we want it embedded within that, domestic abuse inquiry to be embedded within that survey, and also at a national level, so that we can demonstrate the scale and impact that domestic abuse has on NHS staff. And within 18 months, 24 months, we'll have a programme of support that could be taken and lifted and put into other NHS trusts as well.
Gosh, that sounds really powerful, and I'd not appreciated at all that was that kind of broader focus across kind of our communities, but absolutely into some of those individuals and elements of those communities. That must be really, really powerful. Wow. Absolutely want to talk some more about that, but we've had another request in from Marie. Do you want to read that one out? I think you'd picked this song, but you thought this was a good one for Marie's request.
Yeah, so Marie said, just left the Northern General yesterday as a patient. Can you tell all the staff thanks for the amazing care I received whilst I was in, and play a song for them? So this is Faith by George Michael for all the staff at Northern General Hospital.
Brilliant. Thanks, Beth. Speak to you shortly. The specials there. It's me, Michael. It's my Saturday soundtrack, and I've got Beth with me, Chief Executive at Sheffield Hospitals Charity. So, Beth, you kind of really helpfully described right at the top of the show in terms of those 4 areas that you focus on within the charity in terms of health inequalities and some fascinating areas we've talked about there, the research and innovation, and we heard about the robot, the staff we heard about at the top of the show. So, patient experience, patient-centred care, what's the kind of areas you've been supporting within the charity in that area?
Yeah, patient-centred experiences is where we put the majority of our money. Of course, there are some of the things that we're talking about are cross-cutting themes like health inequalities and technology, but the main area, if you like, is about improving the patient experience. The things that we fund are so varied and across the breadth of the trust. So it might be a family room in haematology, for example, where families can come and get a bit of space away from the ward, really, really intense situations that people are in. We fund a bereavement suite in Jessup Wing. We provide funding for activities, memory-making activities in palliative care. We fund... I often talk about this one because I just find it phenomenal. A bone drill, right, in haematology. Talking about haematology again. So this is where if you need a bone marrow biopsy, we've funded this little bit of kit which makes it much quicker and much less painful for patients. So if you can imagine the thought of having to have bone marrow extracted manually, yeah. So a bit of kit that makes that a lot easier. As an example of things that we've got coming up, we've got the ophthalmology outpatients area is, I think the polite way to put it is that it's looking a bit tired. Yeah, so we're going to make it look beautiful. So loads of things right across the trust. One of the big areas of funding, around £300,000 each year, goes into the volunteering services team, which includes arts in health as well, which is hugely, hugely important and, of course, not something that the NHS can be funding. Last year, there were 337 volunteers across the trust, and the team that sort of manages and coordinates those volunteers is what the charity funds with support from our incredible supporters. So last year, 120,500 patients were supported by volunteers. They do such a range of things. So a fair bit of wayfinding. So like I said, I get lost every time I go to the Northern General and indeed the Royal Hallamshire, because A Road, B Road, it's very complicated for somebody like me. So helping people actually get to their appointments is really, really important. But more than that, lots of different things. So over 40,000 pharmacy runs they did last year. So making sure that people got their meds to be able to go home, for example. 40,000 of those. 2,000 patient visits across 27 wards, and that includes things like doing artwork. I'll give you an example which I think is just incredible. So working with patients on spinal injuries unit, helping them to hold a pencil or a paintbrush or do clay activities, helping them to redevelop their motor skills, for example. And it's that where arts are play such an incredible role in the healing journey. The Arts in Health team also work with a range of musicians who go and do concerts and music sessions on wards. So really beautiful sort of violinists going across the ward, which is generally really, really well received. I do have to say, contrary to that, my brother, who sadly passed away before Christmas, he was on Chesterman ward at one point about 12 months ago, and somebody came in from Arts in Health with a violin and started playing. He said, "Oh, chuffing hell, that's all I need. That's the last thing I want." So it doesn't always land well with patients, but on the whole, it's very good.
And we do see those around the trust, and as you say, the feedback from patients, that kind of, a bit like the radio, kind of something a bit different, some music, some kind of taking them away from the situation that they're in. Those volunteers are absolutely fantastic.
Yeah. I mean, absolutely phenomenal. The hours that they put in is incredible. And one of the things that they do, which leads nicely onto the next track, you'll be pleased to hear, because I need to hurry up, is a thing called Tea for Two, which is where volunteers take a cup of tea along for two people, and they go and sit and chat with a patient at their bedside. And so the next song is The Kinks, Have a Cup of Tea.
Brilliant. Thanks, Beth. You're picking some great songs today, Beth. Ones I've not heard before. That was The Kinks and Have a Cup of Tea. So one of the specific other campaigns you're leading on is around supporting our patients with dementia.
Yeah, that's right. So we have had a campaign which is about helping people to live better with dementia, and we are funding work in 3 different areas. So one is about helping people to stay independent and at home and live better with dementia outside of the hospitals. So at any given time, 1 in 4 beds at Sheffield Teaching Hospitals is occupied by somebody living with dementia. So thinking about what we were talking about before, it's not necessarily about social determinants in this respect, but helping people to live better and not be admitted to hospital unless they really need to be there. So we're working with primary care colleagues, and in this instance, we're funding Age UK to deliver work outside of the hospitals, and that has seen a reduction of 80-something% reduction in hospital admissions from the cohort, and a reduction of 70% in GP appointments as well. So it just demonstrates early intervention works. Another piece of work is around supporting NHS staff by giving very specialist dementia training. So we know that when people come into hospital and they're living with dementia, over 90% of people say that they're scared and afraid. So we have been providing very specialist support from anybody from a porter through to a consultant, so that if you're living with dementia, you have the best possible experience across the trust, as opposed to just the nurse providing specific care. And then the third thing, which is the easiest to explain so people like it more, is redeveloping 2 little spaces, which are gardens at the Northern General Hospital on Brearley Ward, and with a connecting reminiscence corridor. So at the moment, there's no outdoor space that is usable. And so we're creating 2 small but perfectly formed gardens, where patients and families can get a little bit of space away from the ward. Wow. We know that outdoor environments are healing environments, so they will be really, really beautiful. I think we're starting on them. Work will start over the next couple of months, and they should be up and running by August.
Oh, lovely. Yeah. Fantastic. And linked to all of that, this next song's a CD you've brought in, a very special song, I think, linked to all of that work that you're doing on dementia, and a special kind of privileged recording we've got.
A very privileged recording, yeah. So we've had some great support on our dementia campaign, which was live from last year. So we were the Master Cutler's Challenge Charity of the Year, so we had support from businesses and people across the city, and we also hosted a really beautiful dinner with Alexis Cratchai, who was president of the Chamber of Commerce, and Joe Carnell Jr., who is a bit of a Sheffield legend because he's the frontman of the band Milburn. And Joe has also written a musical called How Could I Forget, which is about his Glaswegian grandfather living and ultimately passing away with dementia. And this is a huge coincidence, but that musical, tickets for that go on sale today to the general public. He's performing it 9th and 10th of October at Sheffield Theatres. And at this beautiful dinner that we hosted in October, the team performed this song, and for all the right reasons, it absolutely destroyed us all. It's so beautiful. So I think we're going to play a little clip.
And what's it called?
This song is called Lost for Words.
It was absolutely lovely, Beth. Joe Cornell there with, what was the name of that song again?
So it's Joe Cornell Jr.
Sorry.
It's very specific about the junior,
okay.
and I forgot the first 100 times that I wrote his name down. And the musical is called How Could I Forget? The song is called Lost for Words.
Brilliant. Well, I can't believe it, but we are running out of time. I think we've got a whole another show we can plan some other time if you've got some availability, Beth, just to play the songs we haven't had a chance to play and get into a bit more detail on the things that we've talked about. But just in kind of wrapping up, we've heard about the fantastic work that the charity does, pulling together different agencies, supporting our patients, supporting our staff. For those people that are listening, maybe they've been patients or are patients or relatives or just Sheffield folk, if they want to get involved, if they want to donate, want to support, how do they do that, Beth?
Yeah, have a look at our website, sheffieldhospitalscharity.org.uk. Give us a follow on socials, because then you get to see little snippets of the things that support us in April every day of the week. And there are lots of things that people can do. So events, if people want to do a sporting event, for example, so Sheffield Half Marathon, loads and loads of sporting events that we've got. If you have a look on our website for them, whether you want to give as an individual or with a community group, do something fun to raise money for the organisation that goes back into our NHS. It might be that you work for a business and you might want to get your business involved. Choosing us as a charity of the year, or some kind of fundraiser that you do perhaps around employee engagement. If you would like to give a gift in memory of somebody, a loved one that has passed away, that's also incredible. You might want to leave a legacy to Sheffield Hospitals charity. We receive a significant number of legacies each year, and I can't tell you how transformational they are. Loads of different ways to get involved. Thursday this last week we hosted our Chuckles for Charity gig, which is a comedy gig, which was incredible. So we're always looking out for people who want to take part in that. On the 2nd of August this year we have our Red Shoe Walk. So this is the second year of our Red Shoe Walk in partnership with Meadowhall, specifically raising money to support people affected by dementia. So loads of different ways to get involved. Conscious it's Mother's Day tomorrow, and we support, obviously, lots of mums who just happen to be mums and receiving care at Sheffield Teaching Hospitals, and obviously mums and birthing partners at Jessup Maternity Wing as well. So this Mother's Day, we also have a dedication page for people who are wanting to give or fundraise in memory of a mum that they have lost. So again, if you see our website or social media channels over the weekend, you can see how to leave a dedication for a mum that you love and you miss.
That's brilliant. And we've had an email in from Carol, who also said, with it being Mother's Day tomorrow, could we give a shout out for her mum, Pamela? She says she's fabulous and she couldn't survive without her. So this next song, which is a fantastic choice, Beth, introduce the last song before or after I've said thank you ever so much for coming on the show, for everything that you do. The last song then for today's show. Everyone else, I'll see you next week. Ilanthi Fowler, GP and Clinical Director for Primary Care on. But Beth, last word to you.
I couldn't put together a playlist without putting the Spice Girls in there. So this is Say You'll Be There by the Spice Girls.
Thanks, everyone. Thank you, Beth. Thank you, Sheffield Hospital Charities.